Welcome back to the Healthy Commute. I'm Dr. Dan with Dr. Pascal. So we are celebrating a great anniversary today,
Yes.
which is basically the anniversary of the start of COVID, when we shut down basically a year ago, almost to the day. And obviously our lives have been, kind of turned upside down since then. And so what we'd like to do is maybe recap a few things that maybe we've kind of gone through and probably similar to those of you that are listening. And first of all, thank you to all the listeners. We're getting some great feedback from our patients and in terms of things that are helping them. And so first of all, if you ever have any things that you'd like to know more of or topics that you'd like us to discuss, please let us know, either an email, info@lindenwoodschiropractic.com, or let us know during your next visit. But I think we're always very open to feedback.
Absolutely.
So first of all, if we could kind of maybe run down a pros and cons list, if you want to call it, of this last year. The one thing I think for me that was the biggest kind of eye-opening was just, we went from, we have 3 boys that are involved in all kinds of activities, and we went from literally 60 to 0 in terms of great for family time. We'd go out for walks with our dog at night. I'd get home from work, and basically we'd have dinners together 7 nights out of 7. And so that was fantastic for just realizing, how fast life is going.
Yes.
And then finally when we're kind of forced to kind of slow down, and how much, you kind of notice, like, wow, we have to move so fast. And it was so great to just have that time, with family, and just kind of slow things down, which was awesome.
Yes, absolutely. And I think the same thing for me with young kids at home. In many ways, there were some things that changed, but in many ways with really young kids,
Yeah.
a lot of things don't change.
Right.
But then forced to be home, which,
Yeah.
I love being here and I love doing what I'm doing, but having that time at home was so fun to see. Like, everybody in the world is just stressed out and panicked, and there's so much bad news going on with COVID, and people are fearful. And then, you look at these 2 little kids, in my case, who just, nothing's changed, life goes on, let's play and let's have a great time.
Yeah.
So it was a great way to, same things, sort of that family time, reconnecting, and then just being present and learning to just focus on the moment, and just, everything's gonna be okay, let's just have fun right now. And
Absolutely.
so that was fun for me, is to just play with my kids and just focus on the moment and just try to really have fun and shut the noise of the world out. So that was one thing that I really enjoyed for those really 8 weeks where we almost didn't see any patients.
Right. Yeah.
So,
now, in on the other side of the coin, we have, yes, we had some great time. Like you said, we were kind of closed down for almost a few months, and things kind of really slowed down. But then after that, then it's like, okay, so how is that physically affecting us? The mental aspect, all of those maybe bad habits that kind of start. I know we've seen that through patients. Talking to them in terms of they're working from home, their setups at home aren't great, they're not moving. Even like the fact of someone getting into their car to drive to work, walk from the parking lot to their office, and doing a little bit of movement during the day, compared to getting out of bed and going right to the dining room table, and the effect that has had on their posture, on their overall health, their pain levels, all of that I think took a huge hit. So we're seeing that now. Personally, we haven't seen that because our lives have kind of been, we've still, kind of, those things have all been the same. But I think for me, one of the things that really affected me the most in kind of a negative way was, now I've got, boys that are now going to bed almost later than me, because either they don't have school the next day because they're on a day off, day on, day off, day on. And now they're taking out, kind of a full course meal at, 10 o'clock at night. And I'm a sucker for eating snacks, and so now we got this food. So I've been having more snacks at night, which I don't like to do, but I'm a sucker for it. So that's affected my sleep a little bit. I wasn't sleeping as great as I could be, when everybody was going to bed before me. So that's one thing that I think really took a negative effect. So I'm looking forward to, them getting back to a regular routine, getting their activities, and then coming home tired and going to bed, and same thing for me. So I've learned that I'm a true sucker for late night eating, and I was having a hard time to say no.
Yeah, absolutely. I think my biggest con is going to be the social aspect. I've realized more and more, and thankfully, we have a great job where we get to see people,
Yes,
day in and day out, and so I am so grateful for that. And I feel for the people who don't have this luxury that we do in seeing
Yes.
people, but I miss my friends and family, and being able to see people, what role that plays personally for me, and maybe it's different for other people, but it just an overall mental health and happiness, and not being able to see people is a killer for me.
Yeah, and I think saying that, like you said, like my wife and I are both lucky where our jobs were about the same, where
Socially.
we were still, kind of got up, went to work.
Yeah.
We work, outside with people. So that part has been really great for us. But where I've really noticed that aspect is on my kids.
Yeah.
Right, where they've gone from being a part of a team, playing sports, recess, friends over, playing, all that stuff, to now basically being, by themselves, on those days where, let's say, they're not in school, they're basically just by themselves, not interacting with people. And for them, they don't notice, oh no, everything's fine. But just that fact of not seeing someone, communicating with someone, the effect that has on, it's just kind of a blah day.
Yes.
There's not those kind of like, those highs and those lows. It's just blah.
The volume button has been turned down on emotional happiness in some ways,
Totally.
right?
And the biggest part, and I've said this to a few people, is, the old physics equation, especially how it goes to my kids, is, an object at rest stays at rest, an object in motion stays in motion. So for them, when they're moving and they're going to school and doing things, there's things going on, and it just helps them kind of do other things.
Yeah.
But then when they're sitting on the couch not doing anything, to drag them out of off the couch was just such a tough thing to do because of that, because they're just so used to just staying there.
Yeah. You just, not the word lazy, but you
Totally.
get comfortable in the new ways, right? And like we've talked about routines and habits, it's been long enough to have created new routines and new habits, and like forced in some ways, right?
Yeah.
Because you don't have the option to go do this and go do that. And so it's been much more than the 66 days to
Yes.
create these new habits.
Yes.
Now we have to almost
Yes.
recreate the old habits.
That's the thing now, is now some of the activities are starting back, and they're getting back to those things. But I think it's going to take, it's going to take
gonna
a
be hard
while.
at first,
So it's a very conscious thing that for us we want to do, especially for our kids, is, and when we say, hey, okay, and you could invite someone over now in the backyard, you guys could go play basketball on the driveway. But their first instinct is now not to do that, so we have to almost retrain them to go, no, it's okay to call a friend, bring them over, go for a bike ride, all these things. And that's the biggest focus for us over these next few months, is to get the kids back into some form of a regular routine, especially to help with their mental health.
And so I guess, moving on to the next topic for the random show, but at the same time still sort of tied into COVID, is, I guess a lot of technological developments, supplements and different things have evolved, right? Like anytime there's a challenge, people rise to the occasion and new things happen, develop, and we move forward. And so, one of the supplement lines that we use a ton ourselves here in the office, and we have their products, Inatech, came out with a new product, Immune Essentials, right? Mm-hmm. And it's actually fantastic because it is a form of multivitamin that helps support the immune system. But what they've added in there too that I love is the electrolyte support.
Yeah.
So myself during the summer, I'm always, when I'm doing outdoor activities, like longer activities outside where you're sweating all the time, I'm always popping Noon tablets and different things for immune support, or for electrolytes. But now you have it in this form, and it actually tastes great.
Yeah, and I think what people have learned as well, especially from COVID, is those people that are at the greatest risk are those that have a low immune system and pre-existing health conditions. And most of those health conditions, we could work on them, right? In terms of what could we do to increase our body's ability to stay strong and healthy, to navigate times exactly like this, right? So I think most people are now aware of, I need to do everything I can to increase my immune system and stay as happy and healthy as I possibly can, to enable my body to kind of get through these times.
Absolutely. And so, I highly recommend this product. Give it a shot, and I think I'm excited to even have my kids use it, because it tastes like lemonade. Yeah. They're going to love it during this summer.
That's what my kids said. They're like, oh, this is great. Like, thanks for the lemonade, Dad. So like, hey, if it can help you as well, that's awesome.
Exactly.
Yes. Now, the one last thing that we want to talk about is something that we've started doing here in the office.
Yeah.
But the research on this is absolutely amazing. So what we've started doing, especially with new patients coming in, is testing what's called your HRV, which is heart rate variability. On top of that, we're also testing heart rate, blood oxygen levels, and grip strength on each side. And the reason why we want to do that is, as a patient comes in, let's say they're coming in because their neck hurts or their back hurts, and they're concerned about the pain that they're going through. And obviously we want to help them feel better. But the other thing that happens is, as a patient gets adjusted, is their bodies are going to start to function and heal better. And this is a fantastic way to basically test the body's ability to function well.
Yes.
So maybe talk a little bit about HRV.
Okay, so again, and this goes back like 37,000 feet. Why HRV? And it really goes back to the whole principle of what we are trying to achieve with patients. You and I are looking at x-rays, we see problems on x-rays, and we're trying to fix those x-rays to get back to normal, because what those x-rays are really showing us is the breakdown mechanically in the spine, meaning pain, all those things, but it also starts to stress out the nervous system, and that's the bigger effect of the two. That's the one that has actually bigger consequences for our health, longevity, and everything. And so the further distorted, meaning the further your spine breaks down, the more stress there is to the spine and nervous system. In other words, your nervous system isn't reading its environment. It's not adapting to its environment properly. Now that starts to affect everything. Energy levels, focus, immune system, heart rate, right? And so basically what happens is when we adjust somebody, sure, it's gonna feel better, in terms of the pain, the spine's gonna move better, but it also improves the nervous system or the brain's receptibility. So in other words, we've improved or helped the brain function better and be able to adapt, right? Health is the body's ability to adapt. That's what real health is your body's ability to do what it needs to do in certain circumstances to help you be healthy. And that's a really hard thing to measure, right?
Yeah.
But the reality is now with technology, they have these different variables that we can measure. One of them is called heart rate variability. So the more that your heart rate can adapt and vary, it's a direct indication of your nervous system's stress response or ability to adapt and respond to stress.
So in terms of, let's say on a day-to-day basis, let's just kind of make it real, right? So your body, you'll get, let's say you wake up in the morning, let's say you do a workout, you're walking down the street, there's a dog that comes to you, there's an emotional stress, all these things kind of come and go, but your body now has to navigate that. So
Correct.
Either it could basically be kind of a steady line, it just kind of goes through without...
We can use like a 80 beats per minute, for instance, as heart rate, right? So the heart is just beating at 80 beats a minute, whether you're sleeping or whether you're trying to run a marathon.
Right.
And so if it can't change from that, that's a significant problem.
Right. And sometimes we think, oh, that's good if the body's able to stay that. But the reality is like you mentioned, health is your body's ability to adapt and heal as it navigates through the day. Sick is literally the inability to adapt. And that's where things break down. Now, I didn't say anything about pain or disease or anything like that. It's just your body's inability to adapt.
Correct.
So now let's take for your heart. Now, how could your heart navigate those ups and downs during the day? If it could, increase, decrease, change as the needs of the body change, that's now basically saying that your body is now in good shape and it could heal as it goes through the day. That's what we're basically measuring.
So in a simple way to kind of explain it to you for people who might be aware of something called sympathetic, right? The fight or flight, which is the sympathetic nervous system. So generally the higher fight or flight, meaning the more stress you're under, like that stress that you actually feel, the more your sympathetic nervous system is fired up. Generally, the lower your heart rate variability, meaning you're just kind of going and there's no adaptation, no variability. And that's typically where we start to see chronic disease and chronic problems happening. On the flip side, when the parasympathetic goes up, the rest and digest, we see generally a higher heart rate variability. And so what we're measuring with patients is their heart rate variability pre-chiropractic care and post-chiropractic care, and we're seeing trends of it increasing because as we improve the spine, and this can be in asymptomatic people, meaning we're testing this on people that have zero pain, and guess what? Their heart rate variability is still getting better, meaning that even though they don't have pain, they're benefiting from the adjustment because their nervous system is functioning better and they have a better ability to adapt. That's the coolest thing, right? And like in Asia, I was listening to a podcast from a gentleman who studies this ad nauseum, and he was saying, I think it was Korea, they use heart rate variability in some of their wards with very sick patients to actually almost look and predict who's going to be passing away this week or this month. Like that's how precise they're getting with heart rate variability. It's really a variable that they're looking at a ton in heart research, nervous system research, so it's really taken off. So it's cool that simple technology and phone apps now allow us to test this in office, which a year ago we couldn't do it because we didn't have the technology. Now we have the technology, so we're measuring it on patients to again help us understand, okay, how are we helping these people above and beyond just getting them out of pain.
And the cool thing is if you have, whether it's an Apple Watch or these different kind of electronic things that could monitor like your HRV, your heart rate, all this stuff. And the reason why they would be a great thing to measure is to also know how are you doing from day to day,
Yeah.
right? So if your HRV, for example, is not so good, low on a certain day, then we wouldn't want to stress the body even more because it wouldn't be able to adapt and heal through that. Vice versa, if things are, you've slept well, your body's recovering well, you're healing well, then you could take on a little bit more during the day. So that's why those little cool features, those gadgets could help you day to day.
Absolutely, and it's cool because if you have an app, like I use it on this ring, it'll tell me sometimes I wake up and sometimes I feel great, but it tells me, ooh, your HRV is like you've been pushing too hard, whether or not sleeping enough or working out too hard. It says you should tone it down because if your HRV is low, guess what happens to your immune system?
Yeah.
Boom, it's tanking, right?
Yeah.
And so I know the last thing I want to do is develop a cold or be susceptible to something like COVID because, shutting down the practice. Nobody wants that. And so I listen to it. It says HRV is low. Okay, today I'm just going for a relaxing walk. I'm going to rest. So it's amazing that data can track how your nervous system does, telling you about how you're functioning, healing, and adapting. So I love it. I hope it provides benefit and we can help educate patients on it and show them the benefits above and beyond just fixing the spine or getting out of pain, right?
Exactly. So hopefully a few of those topics could help you a little bit in this beautiful little commute that you're having. So again, if you have any questions, you have concerns, anything you need, give us a call here at the office, 204-474-1159, and enjoy the rest of your healthy commute.